Hi, today we'll talk about the risk factors and signs and symptoms of coronary heart disease. Although the coronary heart disease mortality has decreased in the past 4 decades, it is still responsible for about one-third of all the deaths in the United States in people over the age of 35 years. It is estimated that approximately 15.5 million people in United States have coronary artery disease. Nearly one half of all the middle-aged men and one-third of all the middle-aged women will develop some kind of manifestation of coronary artery disease. Now we'll talk about the risk factors involving the coronary heart disease. Number one is hereditary. If it's in your genes, then you are prone to have coronary artery disease or heart attack sometime in your life. Number two is smoking. Smoking is absolutely, causes coronary artery disease in highly prone individuals, especially if they are hereditarily inclined to develop coronary artery disease. Number three is diabetes. If patients with diabetes are highly likely to develop coronary artery disease sometime in their life. Number four is hypertension. If you're hypertensive, there are good chances of you developing coronary artery disease. Number five, if your cholesterol in your blood is excessively high, then there are good chances of you developing coronary artery disease and possibly a myocardial infarction in the future. The signs and symptoms of a myocardial infarction include, number one is chest pain. You have a chest discomfort or a chest tightness which could be radiating down your left arm or into your jaw, and which is also associated with shortness of breath. And once you have the shortness of breath, you may also be having diaphoresis. Diaphoresis is excessive sweating. At times a myocardial infarction can present as a stomach upset. People usually think of developing a upset stomach or hyperacidity and ignore the symptoms and do not seek any medical advice. All the above symptoms could indicate that you could be having an acute heart attack. Hence, it's always wise to seek medical attention. If you are alone at home, call 911 and ask for a paramedic ambulance to be brought to the nearest emergency room where you can be attended upon. And acting fast could save a life. Thank you very much.